Senator Schwertner, since I think it was 2007 when we first introduced legislation to reform the juvenile system. And I know the name has changed now, the Texas Juvenile Justice Department, but some of the same problems seem to exist over the years. And every other session, we try to reform the system. But one of the issues which Senator Colkhurst pointed out is the lack of staff in some of the locations where some of these juvenile facilities are located. And every time we try to change that by consolidating some of those facilities into more urban areas, for lack of a better word, when you had the proper staff, the proper counselors, there was tremendous pushback by legislators in those areas because they were being used for economic development purposes, to create jobs, but not to address the needs of our juveniles. And as from what I read, what I saw, testimony that I heard, and your response to Senator Colkhurst, your bill will allow for some of the facilities to be closed in the event they're not needed anymore, and juveniles move to some of the regional new facilities set out in your bill?
It does not close any of the facilities. It does have various verbiage in there that the department shall evaluate and look at. Now, we do have two new facilities coming online, hopefully, with the budget passing and the money being appropriated for really, hopefully, state-of-the-art facilities that are located in a region that have access to that workforce. Now, as we move forward, we need a plan how to continue to enhance the community level care and restoration, rehabilitation of those youth offenders. And then also, what do we do with more outdated, more rural facilities that have chronic workforce shortage issues? This is very similar, as you said, with our state hospitals, our mental hospitals, as well as our state support living centers. It is difficult to get people sometimes that are qualified to be able to work in the quantities that we need to staff these facilities. And so how do we handle it in a large state? Historically, these type of facilities, whether they're mental health hospitals or state support living centers or TJJ facilities, have been in more rural areas. And that concept is being discussed and changed, I think, over the last 10 years I've been in the legislature about where we should actually be building new facilities going forward.
Well, that approach has not worked for the last 17 years. Senator Whitmire and myself carried the first reform bill. I think it was Senate Bill 103. And the same issues, same problems keep coming up. And until at some point we need to look and provide the proper facilities to take care of our youth. And I know some of them are violent, some of them are mental issues, will not be able to solve this problem. But I look forward and hope that we'll make some improvements with this bill, Senate Bill 1727. But I get sometimes, I'm an optimist by nature, but I get optimistic because we pass legislation, we increase funding, and yet the same problems continue to persist on having some of these facilities located in rural areas where you don't have the support staff, and you will not get the support staff and the professional help that many of the juveniles have. But thank you for your work on this, a very important issue.
Thank you for your comments, Senator. I appreciate you.